हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के सम इम्पॉर्टेंट एमसीक्यू। अ पेशेंट हैज प्रेजेंटेड विद फीचर ऑफ कार्डियक टैम्पोनेट। विच ऑफ द फॉलोइंग इज करेक्ट रिगार्डिंग दिस कंडीशन? पस पैराडॉक्सिस इज ऑलवेज एब्सेंट, कॉस्मोसाइल इज पस पैराडॉक्सिस इज ऑलवेज प्रेजेंट, कॉस्मोसाइल इज ऑलवेज प्रेजेंट, टॉलेव इज प्रेजेंट, जुगुलर वेन कॉलम इज visibly distended without pulsation. This one is the correct answer because the cardiac tamponade refers what to the accumulation of fluid in the pericardial sac. In the pericardial sac, which puts pressure of the heart and impairs its ability to pump the effectively. When the jugular veins column is visibly distended without the pulsation, this is a characteristic what finding of cardiac tamponade. Due to its increased pressure in the pericardial sac, the jugular vein becomes visible distended, but the normal pulsation with each heartbeat are the diminished and absent. Next question. Young male had no symptoms, but auscultation reveals wide fixed split S2. The clinical diagnosis is AST, VST, TOF, and BAV. Here the best answer is the AST, atrial septal defect. What is the atrial septal defect? Is a congenital heart defect characterized by the what? Abnormal opening in the septum. Abnormal opening in the septum. कहाँ पे? वॉल में. Between the two arteries of the heart. A wide fixed split S2 on auscultation and characterized finding a atrial septal defect where the abnormal communication between the atrials. It allows increased blood flow from the left atrium to the right atrium, causing a delay the closure of the pulmonary valve and the resulting a wide fixed split S2. Next question. Renocerebral mucormycosis is associated with diabetic ketoacidosis, pregnancy, antibiotics, inhaled steroid. Best answer is diabetic ketoacidosis because the rhinocerebral mucormycosis is also known as zygomycosis. Mycosis is a serious fungal infection caused by the various species of the fungal belonging to the cause mucorales. It primarily affected the nose, sinus, and brain. Diabetic ketoacidosis, rhinocerebral mucormycosis is strongly associated with uncontrolled diabetes. What uncontrolled diabetes, particularly what? Diabetic ketoacidosis. Next question. A 90-year-old male chronic smoker presented with fever, a painful lump over his left cheek just below the ear, and difficulty in swallowing or talking. The patient also complained of mild testicular pain. What is the most likely diagnosis? Cervical tuberculosis, diphtheria, mumps, and lymphoma. Here the main point is the left cheek just below the ear and difficulty in swallowing or talking. The best answer is the mumps because the best answer here the symptoms, the most likely diagnosis for the 90-year-old male with a fever, painful lump below the left ear, and difficulty swallowing or talking, and mild testicular pain is what is the parotitis and orchitis due to the mumps. Parotitis and orchitis due to what? Mumps. Mumps is a congenital viral infection that primarily affects the salivary glands को affect करता है mumps, which are located near the ears. It caused by the mumps virus, a member of paramyxovirus family. Mumps is characterized by swelling and inflammation of one or both parotid glands, which are largest salivary glands. The virus spread from person to person. कैसे करता है? Respiratory droplet के through. Respiratory droplet, and such as those produced by coughing or sneezing or talking. It can also be transmitted by direct contact with infected saliva or by touching contaminated surfaces and then touching the mouth or nose. Next question. A 60-year-old male, unknown case of COPD, was admitted to the ICU and was on oxygen therapy with 2 liters of oxygen. He was found to be hypoventilating and on arterial blood gas analysis done showed PS 7.33 PS2. Which of the following is the next step best in management in the patient? Non-invasive PPB should be given. Invasive PPB should be given. Increase the oxygen flow rate, incubate and start the ventilation. Best answer is the A. Non-invasive PPB should be given. In a patient with exacerbation of COPD with present with acute respiratory failure and hypoventilation, NIPPB is considered the initial treatment of choice. NIPPB, non-invasive PPB, should be given. Positive pressure ventilation by a mask or similar interface without the need for endotracheal intubation. It has to improve ventilation, oxygenation, and elevate respiratory distress by assisting the patient breathing effort. Next question. So we also discussed the invasive B and D. Invasive PPP should be given intubate and start on ventilator. Invasive positive pressure ventilation intubate and starting on a ventilator is generally for cases where NIPPB failure is contraindicated. It is associated with potential risk and complication, and therefore NIPPB is preferred as an initial intervention in this scenario. And if we increase the oxygen flow rate, the increase in the oxygen flow rate alone would not adequately address the underlying issue of the hypoventilation with high PCO2 levels. It may improve oxygenation temporarily, but it does not address the ventilation problem and the resulting respiratory acidosis. So today that's all, and keep revising. Thank you.